I'm going to share the story of two different patients with you to highlight the importance of adopting some of these nutritional options. And I want you to please listen very closely to these stories. These are true stories. Patient number one, she's a 69-year-old lady, pardon me, with symptoms of dizziness and forgetfulness, and was also diagnosed with a brain tumor, which was benign, not cancerous, and it was, something that can be easily operated. She has a medical history of being diabetic. She has angina, which is chest pain. She also is an hypertensive patient. She was overweight. She had a condition called carpal tunnel syndrome, which was operated, and she recovered fully. Some of her medications include BP medications, diabetic medications for cholesterol, constipation. And before she was operated, they did an evaluation and discovered that she had a blocked artery, and she was treated with angioplasty. Stent was inserted. So eventually, she underwent the surgery, and then the tumor was successfully removed, and all the doctors were, thinking that that was it. This is a success case, but the situation took a different turn. She, after surgery, she developed meningitis, which is a swelling of the brain, which was part of like complications of what she went through. So she needed a brain shunt. After the procedure was done, there was bleeding. She went into coma. She started having seizures. There was impaired brain function, and she had more seizures. Then she recovered. Then subsequently, again, she declined. She started having more seizures again, started falling. All these were happening within weeks and within some months. She was in and out of hospital. She was having all these conditions. Eventually, um, they did an emergency abdominal surgery when she was having all kinds of complications. But the sad part of the story was that she eventually died from liver failure 1 year and 10 months after the brain tumor diagnosis. Now, this is the important part of the whole story. After her death, investigations were carried out, and they discovered that liver failure was in large part due to his that the death was caused by liver failure, and this was due to the kind of diet she has. Number one, two major causes were discovered. The two major causes for this liver failure, they are exposure to the standard American diet and also too many medications. And the person that shared this story was actually sharing the story of his mother. He is a top integrative cardiologist in the US. But before he ventured or changed into integrative medicine, he was in conventional medicine, was practicing in one of the best hospitals in the States, in the US, and he shared this story. And he said that it was the death of his mother that and investigating the root cause of her death was what made him to begin to see that there is another way a patient can be treated and not the conventional way. So they discovered that this patient, which was his mother, she was placed on 10 different medications, and five of all those medications were actually metabolized in the liver, and this has consequences. Some days before she died, they found out that she had severely elevated liver enzymes, and then um, which led to certain complications. So the key points to this case is number one, that they discovered that half of her medications are metabolized by the liver. This is someone that was diagnosed. I mean, sorry, was it was confirmed that she died from liver failure, but she never had any history of liver disease. But they discovered that during the course of um, her treatment, she was, coming off and on with certain changes, neurological changes, which were not quickly picked up to be signs and symptoms of a failing liver. So, despite having diabetes, despite having heart disease, despite having a brain tumor, she didn't die from these conditions. She actually died of liver failure secondary to the side effects of the medications she was on. So, her cause of death, which is the third leading cause of death in the US, was due to medications that she was prescribed. This story is to emphasize the to help you see the dangers of what we call polypharmacy, prolonged use of different kinds of medications. They come with severe side effects, either for the kidneys or for the liver or for other parts of the body. So anything you can do to reduce the number of medications you are taking is a step in the right direction, because you are not healthier by taking more medications. Rather, you put your body under a toxin load, or what I'll call toxin overload. So whatever you're able to do right now to reduce to the minimum the pharmaceutical medications you are taking, the better. That is what this story is all about. That is what this story is trying to show us. Now, the second patient, the second case. This is another case of a lady. She came down. She has heart disease and diabetes. This is her medical history. She has osteoarthritis, hypertension, fibroid, glaucoma, and so on and so forth, as is shown on the screen. Different health conditions, and she was also on different medications up to 19. These are our initial medication list. Different kinds of medication, until she decided that no, there must be a way out. I can't continue to take 19 medications, 19 different medications, and these medications, they come with their side effects. So what did she do? She decided to um, change the course of her treatment. She embraced nutritional detox with the goal of eventually reducing or weaning herself off her medications. And what happened? The long and short of the story is, this is what one thing I want us to understand is this: nutritional detox should be a lifestyle. Even though we are going to introduce you to this program, don't see it as a one-off thing. Try as much as possible to make it a lifestyle, eating whole foods, doing your detox. Even though we are going to just do it for maybe two weeks max, or no, sorry, if you want to eat, I will actually advise that if you can extend your detox, depending on how severe your situation is, you may need to do a longer detox, like maybe 30 days. That's about 4 weeks, instead of just the 2 weeks that I've recommended in this program. So depending on your situation, 2 weeks is just the minimum. You can extend it, and after the program, make sure you still go back to do your detox very frequently. So the result of this patient that embraced another aspect, a more natural solution to her problems, was eventually, over the course of 7 years, because she made this a lifestyle, um, Her medications, her prescription medications were reduced from 17 to 2. And also, um, she her weight improved, her BMI improved, her blood pressure also improved. And there was also improvement in all basic health parameters that she had. There was improvement in overall quality of her life. And she started the program at the age of 88. And by the time she was 95, she was still able to live an independent life. She could drive, she could exercise, she could go out by herself. So this portrays the fact that no matter the age you are, if someone that is 88 years can do this program and improve her health, you are not an exception. Whatever stage you are right now in your life, whatever age you are, you can also do the same. So, what are the key steps to take in preparing for this nutritional detox? The first thing is you list goals for yourself. What do you want to achieve with this program? If your blood pressure is in the range of maybe 150s or 140s, you might say, okay, at the end of this program, I should have my blood pressure in the 120 or 118 over 70 something range. And you take this program very seriously. So you list goals for yourself and make them achievable and measurable. Understand that this journey is not only about you and is not only for you. Realize that there is a world of people around you depending on you to succeed, because if a man's health fails, every other thing fails. So, to help you, to motivate you, you may have to list the names of the loved ones whose life you want to impact with this program. So, enjoy the journey. This is going to have a major positive impact on your health and set you on the right course towards optimal health and overall improvement of your health and well-being. So I congratulate you once again as we start the nutritional detox. The next videos will tell you how this what the detox is all about and how to go about it. So congratulations again, and I'll see you in the detox program.